Good morning, everyone. It is 11 o'clock and it is time for another Workforce Wednesday. We are so excited that you are joining us today. I just wanted to let you know we have a great lineup of speakers for you today. My name is Jackie Buck and I'm the Director of Workforce Strategy for the state of Minnesota. Workforce Wednesday is by our illustrious team of workforce strategy consultants, and it's a networking series that focuses on sharing best practices and workforce strategies. We hold our events the first Wednesday of every month from 11 a.m. to 12, and then we have a special session from 12 to 12:30. It's called Unplugged, where you can unmute yourself and you can show your camera and you can ask questions of our panelists and anything else that you want to know more about. We're really excited to have, like I said, our presenters and our workforce strategy consultants with you today. Deed has 6 workforce strategy consultants that work regionally throughout the state, helping businesses with talent attraction and talent retention strategies. And that's a big piece of what we're going to talk about today. It's all about recruiting strategy. We are all about employers, we're all about workforce, and our mission is to help businesses develop innovative workforce solutions by aligning and connecting resources, facilitating collaboration, and leveraging expertise. So with that, I am going to turn it over to Jessica Miller, who is a workforce strategy consultant for South Central and Southwest this morning. She is going to be your host for today. And while I'm doing that, make sure you post in the chat where you're joining us from today. Thanks. This session will be recorded. Jessica.
Great. Hi, everyone. Jessica Miller, as Jackie said, and I cover South Central Minnesota. We are so excited to kick off our first Workforce Wednesday of the year. And we're so happy that you're here with us today. At today's webinar, we are going to focus on recruiting strategies, and we're going to talk about ways that employers have rolled up their sleeves and gotten creative with their recruiting strategies. This will be a guided conversation, and we want you to please feel free to ask your questions into the chat as we go. We'll also be taking those audience questions during All right, so where were we? Did you hear anything I said? Okay, perfect. Yes. So we will want you to put your questions in the chat, but knowing also we have that unplugged session at the end where we can turn your cameras on and your microphones on and join us in that conversation. Those are always really lively conversations, and we're always excited to hear what people share back and forth and during that networking time. Our employer guests today are from the healthcare sector, as we're kicking off Healthcare Month here in Minnesota. However, many, if not all, of the strategies that we'll be talking about today will apply to any sector. So if you're in manufacturing or construction, don't leave. We want you here today because you're going to learn some new ways to engage talent, and you're definitely in the right place. You are in for a treat with the panel of brilliant women that we have today, and we're going to talk shop with 2 leaders who continue to push boundaries and try new things to support our healthcare sector, which we know is in critical need of workforce right now. These women say yes when the answer is no and are willing to see past the hurdles of being the first to try new strategies. It's going to be a great conversation. You'll have opportunities to ask questions through the chat again, and then live during the Unplugged at noon. After our panel discussion, Valerie Dufour, Executive Director for HealthForce Minnesota, will be sharing information with us on the governor's CNA, or Certified Nursing Assistant Initiative, which is an initiative to recruit, train, and deploy at least 1,000 new certified nursing assistants in long-term care facilities during the month of January. And the state will provide free resources to do that training in a lot of cases. So those of you who are in healthcare and want to learn about that program and how to get involved or how to support or how to engage, that conversation will start at 11:45 a.m. Then finally, we'll wrap things up with our unplugged question and answer, again, where we'll have opportunity to ask those questions live, unrecorded and face-to-face. But quickly, before we move into time with our guests, I thought I would throw a little bit of something funny in here. Anybody resonate with the images that we have on the screen today? Creativity and recruitment and one more extra thing to the plate. And then, we're hearing over and over again that the need for employees for facilities are in the hundreds. And so just something to kind of set the stage and make us laugh before we get going. All right. It seems like everyone needs talent and is searching for ways to stand out in a time where there are more job seekers than jobs, and our workforce has options. They can take time to find opportunities that align more with their values, their lifestyles, their financial goals. Employers are scrambling right now to find out what each of those things means so they can make that match and find the right person for the job. I have the best job. I get to work with employers like all of you. Many of you I know I've seen have joined us today, and I want to say hi to all of you. And I get to help you develop strategies for recruiting and retaining talent. And I get to link you with state and local partners and get people meaningful work. And I also get to meet and learn from people like we have with us today. So our guests today include first, Annette Greeley, who is the president and CEO of Jones Harrison Residence. Annette and I met through her participation in our statewide healthcare advisory committee. She's been a driving force for change and continues to inspire that group, as well as many others. Annette, do you want to share a bit about yourself with the group today?
Sure. I have been in healthcare since graduating college, started out as a nursing assistant and have worked in housing. I've worked in rural Minnesota and I am in the metro now. So I do, feel like I understand the small towns and the needs that they have compared to the needs of being in a more of a metro area. And I just love this career field, and I just feel it's a passion of mine now. How do we get more people to realize what a great profession this is, and how can we do a better job as employers? I'm putting the word out because I think for such a long time, we really haven't promoted ourselves, and this has given us a great opportunity for people to see, that they can have careers that make a difference in people's lives.
Love it. Thank you so much for being with us here today. And we'll go to the next slide. Our next guest is Erica Sword. So Erica is the talent acquisition manager with Monarch Healthcare Systems. And Eric and I met through the South Central Healthcare Sector Partnership, and I continue to be impressed and inspired by the innovative and creative ways that she's been seeking talent and building her talent pipelines with youth and other people that are looking for work. Erica, would you like to share a little bit about yourself with us today?
Sure. Hi, everyone. My name is Erica. I've been in long-term care for over 10 years. Started out as a CNA with Beverly Company. I don't know how many of you know Beverly Company, bought out Golden Living. So started out as a CNA, kind of worked my way up, with positions. I have a passion for long-term care. I have a passion for finding the right people to serve our residents in long-term care. And I would say over the last probably 6 to 9 months, my viewpoint on finding people has changed. I really want to educate people on the different jobs we have in long-term care. I'm just finding out that people, when they think of long-term care, and I know some of the questions that'll come up, I'll definitely refer to this again. People don't know all the wonderful opportunities we have in long-term care, all the wonderful jobs, not only the CNAs, nurses, there's culinary, there's therapeutic rec, there's all these wonderful jobs that are within long-term care. And I just have a passion educating the high schoolers and, even middle schoolers with all these wonderful jobs that we have and all these other opportunities.
Thank you so much, Erica, and thank you for joining us. And I am not sure if Val has popped on yet, but I'll go ahead and introduce her. Our third guest would be Valerie Dufour, and Valerie is the Executive Director for Health Force Minnesota. She serves the state of Minnesota and is just a wealth of knowledge and resource to our providers. Valerie and I first met working on Scrubs Camp, which is a hands-on experiential learning camp for youth who are interested in pursuing a career in healthcare. We have these type of camps or experiences across sectors. So those of you who are in different types of sectors know that there are opportunities to engage in with youth in those ways as well. And you can reach out to us and we can help make some connections for your local area. And just to check, is Val here yet?
Yes.
Oh, you are.
I am.
Hi, Val.
Yep. Can you hear me?
Yes.
Thank you. So Valerie Dufour with Health Force, and apologize, I joined a little late. I'll just share a little bit of my background. It sounds like is where we're headed with this. I have to say that my interest in healthcare started with my first job as working as a nursing assistant in college, and kind of finished college, thought about, well, what do I want to do next? And really built off of that, the joy that job gave me. And I still tell people that has been the most, intrinsically rewarding job I've had in my career. So, as things happened, I have never actually worked in long-term care. But I was in healthcare consulting for about 10 years and have been working within our Minnesota state system for the last 20 years on healthcare workforce. So, kind of a big assortment of projects and initiatives. So happy to join you today.
Thank you so much, Valerie. All right, so all three of these women are amazing healthcare leaders and partners, and let's start digging into our conversation here. So why don't we start out with Annette, and then we'll go to Erica and Valerie. If you have any thoughts that you want to add to any of these questions, feel free to pipe in. But first question is, we know that recruiting during a workforce shortage has posed challenges, obviously, but recruiting during a worldwide pandemic, in the healthcare field. Can you share with us a bit about what you've experienced and what you've done to ease that challenge posed by the workforce shortage?
Sure. One, I think partnering with DEED, with Adasia and the group that DEED has to support us is very vital. They have so many resources. They can connect. They helped us connect to some nonprofits in Minneapolis that are doing training for CNA and other healthcare positions so that we could let them know we exist and that we have job opportunities with us. So that I think was very critical. And also to reaching out to speak to these groups and to these students. I know I went and engaged a group last summer working on their CNA, and we got a number. We got like 5 out of the group that decided to come work for us. You can do your bonuses and hiring bonuses and retention things, but you do need to make that human contact too. And I know the struggle is time. We're all doing 4 jobs at the same time right now, and especially with COVID, with testing and the regulatory and infection control things. But we do need to take that time to reach out and engage with groups that are doing, especially with new Americans. I am fortunate that in the metro area, we do have a larger populations of new Americans, and this is a career field that is obtainable for them as they're starting their new life here. And so engaging with those groups and helping them here. In the rural areas, I did a lot more engagement with the high schools, the elementaries. We had a technical high school that made sure that we were there at those meetings, participating on their advisory boards, and being engaged in the community. And Erica's exactly right. We have more than just nursing. We have accounting jobs. We have facility management jobs. So they're mechanical. We have, housekeeping, dietary, computer. So we have been trying to reach out, and Indeed has been a great part of that connection to getting with these groups to help them know that, we're more than just nursing. And how do we get those connections and the student connections in here?
So do you attribute a lot of that community work that you've been doing, setting the stage, getting active, to being able to make those connections with schools? I hear often employers saying, I don't know how to get connected to the schools, and the schools are saying the same thing.
Yeah, I think Deed, is helpful with that, and I think like you have to, in the metro, it's probably a little different than being out in Bruton, Minnesota, or Painesville, Minnesota, where I was out in those rural areas where you can, those communities are smaller, you can make those connections a little bit easier, and it's just making that call saying, how can we work together? I know leading age and care providers have tools for us to do those connections too, and that is another resource. If you belong to a trade association like care providers, leading age, they are worth their value with tools and resources on how to make those connections with your schools, how to make connections with other employment entities that you can partner. We often forget about groups with disabilities, but when I was in Elk River, I had a very strong relationship with the Elk River High School, and we worked with kids who were learning independent living skills, and it was a wonderful relationship, and we had some wonderful employees with that group. So I think we need to broaden our horizon too on groups that we want to connect with.
Great, thank you so much. Erica, do you have thoughts on this one?
Sure. Just kind of going off the partnership with like the high schools and stuff. Maybe I'm a little bit aggressive, but I literally went on the school website and looked up the directory, and I was like sending out emails to a couple people like, hey, I'm Erica from Monarch. This is what Monarch's about. Like, are you the right person to connect with? I'd love to come in and speak to your students, or, can I provide a flyer to hang up in your high school? And sometimes I got turned down. Other times, they were like, yeah, send a flyer, we'll hang it up. Other times we were invited in to go and set up a booth during their lunch, hand out swag and, talk to them about all the different job opportunities we have in Monarch. And I know that other things were touched on that I kind of had written down here too. Another big thing is like community involvement that I found out was a really good thing for us. We have business development people within Monarch, and our recruiters have been partnering with them with like community events, like getting involved in the chamber. Because I don't know if anybody's involved with the chamber, but you can post your jobs on on a lot of chamber websites, which it's free, and it's just a great resource. When we tried to do some hiring events, were hit or miss, with being summer out, we used chamber bucks, which is a great way to tie your community with the chamber, doing stuff like that. Another thing I was going to say, I know it's not really like when related to like partnerships and things, but when the pandemic hit, one of like the first things I did is I kind of was like, okay, what are we going to do now with this work shortage? And I created a storyboard of our applicant flow. Like, what pieces are we missing? What are we doing? What pieces can we change to make our process at Monarch better, so that the applicant flow can go quicker and we can make the process smoother for our applicants with the change of how things are now, interviews, reference checks, things like that. So that was a huge thing that helped us at Monarch regarding that. Another thing too is, I know people don't even think of this, as international students. Down south, you have Mankato State. That is such an untapped resource. I have been working with Mankato State with their international students it's a great program to work with, utilizing them.
Thank you. I really love that idea of kind of doing like a Kaizen, a flow of your recruiting process to find out what's not working anymore. Was there any surprises that stood out to you?
I literally wish I could like take you into my office and show you it. I like took a tag board out. We met, we had colored, I had 3 different colored Post-it notes because I'm like that. We laid out our process in one color. We put our barriers on top of what our barriers were in another color, and action items on the bottom. And we worked as a team and we got it done. And like our process is smoother. It just like it sounds so silly, but like it made a world of a difference for the facilities, for us, and for the applicants.
That's fantastic, because the needs of today's workforce are different than they were pre-COVID, right? So there's different ways of accessing information, different ways of applying, different ways of connecting. So to be able to take a granular level and look at that is super smart, because we have to do business differently.
Yep.
And one of the things that shifted are wages, and wages came out in our pre-questions registration for this particular event quite a bit. So I'm wondering, just maybe some themes around wages. So some of them were focused on where to find competitive wages for your region. Some of them were focused on how to find money to pay for those higher wages. And some were focused more on just wondering how everyone else is managing those needs. Any one of you, can you share strategies that your organization has implemented to be competitive and retain the staff that you have from that wage perspective?
I'll start with that. Being in the Minneapolis area, wage challenges are extra challenging because we have a lot of other employment to contend with. The county, has a starting wage of $20 for, all positions, and you're like, how do I compete against that? Starbucks can raise the price of their mocha. I can't really raise the price of my product, so it puts us in a little bit of a challenge. There are resources out there for looking at wage scales. We worked with Leading Age. I know Care Providers also has that information. So whether you're a home care, small entity, doesn't matter where you're at, they have that data that's broken out. Leading Age or Deed has that data that they can also help you look at wages. And then what we did, we did have capacity. We went through our budgets with a fine-tooth comb, and if I could save here and there, I switched purchasing, GPOs. I switched everything. We looked at efficiencies, and we knew that we had to do wage enhancements for our organization, and so we did implement wage enhancements for our nursing assistants in July. Then we phased in wage enhancements for RN LPNs in August. We phased them. I had all staff meetings. I was very honest with them, explaining why how we were going to do it, who we picked, and how we were going to phase it, because we knew people would say, well, how come we didn't get it, or how come you picked this group? So transparency, I think, with your employees is the utmost importance. And I know a lot of people and a lot of companies have shoestring budgets, so it might be like, I don't know where to find that money. It's just something you have to look through. Like I said, we were fortunate that we were able to make adjustments in different areas, and areas people didn't even think about, like the group purchasing, where we were buying our medical supplies from, and we saved 30% off that switch, and switching dining and so many other things, and trying to look at the efficiencies of our organization. Not all, I know, have that luxury, but as I said, you kind of go through what you can do.
Thank you for that.
One thing that we do is market analysis, and we do it all year round for me and the recruiters. And it's just a simple spreadsheet. I don't know if it's like a professional market analysis sheet or not, but I created it, and we do it all year round when we are, we see things that are like, whoa, like that's competitive. We plug it in there, and we have gals that take care of our compensation and benefits, and it's a shareable document, so they're continually seeing these. So when we're noticing like, hey, there's a region specifically I can think of right now, Plainview, Minnesota, we're not seeing a lot of housekeepers hired there. Well, when I did a little bit of market analysis for housekeeping, I can see why the wages we are paying weren't even competitive to, other people. So doing those market analysis and have it continual, is good. Even sign-on bonuses. I have an area for sign-on bonuses in there. I know everybody's doing them, but just to continually keeping that updated, so you're tracking and trending what other people are doing, not only in healthcare, but other people like hotels, especially if it's like housekeeping and a culinary. You have Arby's that are paying $18 an hour to have somebody work day shift. Keeping those tracks and trends on a spreadsheet is really valuable for your company.
Data-driven decision making, that's very smart. And it's interesting too, like, events like this really help HR professionals and recruiters to really look at, and hiring managers to really look at how they are, what gaps, right? So Erica talked about putting everything on the wall and looking at where those missing spaces are, what's gray, what's not working anymore, how can we do this better? Other tools that you have available, you've got your associations, but don't forget your social media groups. Join those groups. It's amazing what information is available in them, and the spirit around recruiters and HR professionals is such one of sharing. Even if you're not in HR, you can join those groups, and they are more than willing to share best practices that are happening around the world. So just some tips there in that regard. But we know also that wages aren't everything. Wages are important, but they're not everything. Culture, training, career advancement opportunities are also tools that people that draw on and retain a workforce. How are you currently leveraging those non-wage benefits that your organization offers, and how are you promoting them to those future talent pools to draw them in?
Sure. We do have a lot of great benefits in our industry. We're pretty fortunate that we can offer scholarships, loan reimbursement for people who we can reimburse for CNA or pay up front for the CNA program. We're really grateful for the program that's coming out to try and recruit the 1,000 members. And then for the RN LPNs, we can help with tuition assistance. We can help if for new graduates coming to offer repay loans at some facilities. I've, repaid, $350 a month in student loans, to help them out. And those things are allowed on the care center side. The assisted living side is a little bit different. They don't have that type of reimbursement structure. There is some monies that you can go for through the Minnesota Department of Health for the assisted living side to try to offer scholarships to your staff. The other, we work to maintain, all the affordable health care and the other benefits for our staff, and we, those are vital. And I think, like you said, culture involves the benefits and just how we take care of each other during this time. We've been trying to work with caregiver burnout. We have mental health support that is available to our staff that we work with. And I think you have to, with the pandemic, the stress that is going on in people's lives, not only at work, but at home, how do we support them in creating that culture, which, improves workforce retention, but then they also go and tell people, you know what, I work for a really good company that supports me personally, has good benefits. and that we do have the tuition and loan reimbursement. And that's one thing I know for a long time, a lot of us in our industry have been trying to promote. Like we have the ability to help students get through school and reduce that debt amount.
Pretty much the kind of the same thing. You know, we have great loan reimbursement opportunities, scholarship opportunities. Our partnerships are huge for our colleges who we partnership with. I'm very active with our colleges we partner with. I promote them quite a bit, whether it be on social media or having the facilities hang up flyers and talking about the different career opportunities. I always encourage our partners to bring lunch to our facilities to talk about like all the different opportunities they have, and just kind of saying like, this is the grant money you can get plus the scholarship opportunity. You could potentially come out not having any, you know, debt for school. Like what an awesome thing that would be. Also within Monarch 2, same thing. We have a great NAT, which is Nursing Assistant and Training program that we put people through. We have TMA training. We have all sorts of fun events at Monarch. We have Monarch Mondays. We have theme days. We have all sorts of fun things going on here. We have PTO cash out twice a year, really highlighting those benefits, 401k, things like that.
One thing I want to say about Erica is she's extremely active on social media. So she's sharing all of this information multiple times a week and really celebrating it and looking for ways to get that information into everybody's hands. And so there's power in getting that information out there, and using social media is a huge thing. If you're not doing right now, I would recommend that. I just want to put a pitch out there for other training opportunities for folks that aren't in healthcare necessarily. We do have programs, grant programs through the state and with our education partners. And we also have the pipeline program. So if you're looking for ways that you can provide training for your staff and receive some funding to help with that, that's something that you can reach out to one of your workforce strategy consultants with, and we can put you in touch with the right people and help make those connections for you. So just know that there's opportunities beyond sectors. So the next question is around creativity. So we know that is a key component in a market like today. So what out of the box ideas have you implemented to attract talent to your organization? And are there any of them that surprised you with how successful they were?
Oh, well, I think one that we did, I worked with a high school, and we actually got a gerontology course approved by the school board in partnership with St. Cloud State, and it was actually a PSEO, so kids could get college credit for that. And we incorporated what we call service learning, so those students would come to our facility once a week and do an activity with the residents. And so one week the residents would pick what maybe they wanted to learn how to use their cell phones better, and then the next week the students wanted to learn, you know, how to play a card game, cribbage or something from the residents. So they had equity going back and forth and what to learn, and that program was very successful. We had 17 students that did it, and like Erica said, I'm going to tell you, if you can bring Caribou Coffee or Starbucks to their lunch hour and have just an open session, that's like gold. I couldn't believe, you know, we brought Subway, brought Caribou, and we had a lot of students, and we got the active enrollment into that program. And it is a program that other communities are looking at trying to replicate. The one thing that the challenge might be is the schools are struggling with workforce also and with financials, but if you can make that partnership, so we actually paid for the bus to transport the students back, so the school didn't have to worry about that. So I think just thinking outside of the box like that, I'm sure Erica's got a ton too. It is just thinking like there's no bad idea. Just try it. What's the worst thing that's going to happen? It doesn't work. That's all I tell myself. That's the worst thing. Just try it. If you have an idea, try it. That's all I can tell you. Try it.
That's the perfect advice. And know that you don't have to know all the answers either, because our education partners will help you. They have needs too, and they love it when people come in and help them with the classes and explore career opportunities. And they have the skills to do curriculum or to help make some of your ideas come to reality. So don't discount those partnerships.
I could probably talk for 15 minutes of the wild ideas I've done, and everybody would be like, are you kidding me? Like, just some crazy things that I just wouldn't even think that I've ever have done. I mean, this summer I went to driver's ed classes and talked to kids. I'm like, hey, I brought donuts. I said, you guys are all getting your license. You need a job. Why not come work for Monarch? You don't want direct care? No problem. You come work in our culinary department. You can come work in therapeutic rec. I went and handed out distant learning material for high school students. I said, hey, I'll volunteer if I can hand out flyers for Monarch and a little swag bag to all these high school students. So one afternoon I went out there and I was handing out distance learning material for a high school. Just crazy things. Small Business Saturday, we donated a whole bunch of Monarch bags to Small Business Saturdays, and we donated them if we could put in our flyer in there for what Monarch has available. Like Jessica said, my social media stuff, I'm a year into LinkedIn. So I'm still brand new to LinkedIn. I don't know what I'm doing on there. I'm just trying things. And if they work, I kind of have my own little party. I'm like, all right, it worked. Like I got 5 likes, I'm feeling sassy today. Other things we've done, which I'm super excited about, is we just did an advertisement in the Minneapolis airport. Like, what the heck? How crazy is that? I just was like, people are going to be there for the holidays. Like, I'm just going to throw our wages on there and we'll see what happens. We're tracking it with a QR code. I can't give you numbers yet. Over the summer with the baseball season, we threw up an ad on the buses, on the bus system. So the buses that went to the metro facilities and also on the shelters, we put our Monarch Now Hiring on there. All different kinds of things we've done. I guess I could go on, but those are just some of the crazy ideas I guess we've done. One thing that I did, and I saw somebody had mentioned it in the comments, is HOSA. They're the future healthcare professionals. And I just recently found out about them and I am a fan. Like, if you haven't connected with them, they had an event a couple months ago. I believe it was in Plymouth, and you're in healthcare. It's an amazing group. Like, you need to check them out. And when they have career opportunities, I believe they have one coming up in St. Cloud in February. I want to say definitely check them out and connect with them. They're a great group.
HOSA is wonderful.
Yes.
And for some of those employers that are joining us today that are smaller or even our larger ones, don't discount some of those easier type of things like Erica mentioned. Make sure you're upfront with your wages. Post your wages on your job postings. Mm-hmm. Getting back to applicants in a timely manner, that is a huge thing right now. Some employers are having a 24-hour turnaround time for interviews or job offers. Some are doing job offers right on the spot. Don't discount the power of having paper applications and offering people assistance to come in and fill out those paper applications. And please, whatever you do, have easy application processes. So look at how it is to somebody brand new to apply to your company. Is it easy, or does it take 20 minutes because you'll lose them? Can you apply from your phone with a click of a button? We have some employers that will offer the ability to apply or respond via text. Again, huge things that don't take a lot of resources that really fit in with today's market. as far as logistical type of things, not counting things like flexible scheduling and offering a variety of different hours of shifts, split shifts, maybe just a couple hours or maybe just on call, those type of opportunities as well. So we have time for one more question, and I'd like to follow it up here with what's one thing that you wish or you hope that people who joined us today walk away with or come away with from our conversation so far?
Well, I would say the one thing is that don't limit yourself. By limiting yourself, you're creating barriers. So one, make the process easy. Also understand who you're working with, what age group. That texting thing, I got kids that don't even know how, they don't answer the phone, they only communicate by text. So really understanding who you're communicating with. They don't like phone calls, they want text. And knowing that no matter where you live, it doesn't have to cost a lot of money, and it's engagement or Erica's ideas. I think we've all kind of tried those ideas, and they can. You're going to have to do them over and over too. They might not grasp the first time, but if you keep going out there and you keep exploring opportunities to engage with people and to teach them what you're about and what opportunities you have, the better. And to have them understand, I think we need to do a little better job of telling people, like, we're more than just nursing. We have all these other opportunities. It's a great field, and you can start in dietary. You could start in housekeeping. You don't have to start as an aide. Try it out. Work with Deed. We also did the CMJTS. Like, yes. There are kids looking for work opportunities to learn how to work and to try different groups. There are groups in the disability community, the New American community. Just go for it. And no, it might be a little slow, but it will work over time.
Planting those seeds. Yep, absolutely.
I would say the same thing. Like, if you, I don't know, budget wise, it doesn't have to cost a lot of money to recruit staff. Build that relationship or that partnership with your local high school, with your chamber. I think people are dropping some other ideas within the comment section. Building a partnership with a local college doesn't have to cost a company money. It's just, I believe signing a contract. Don't quote me on that. I don't want to, get in trouble or anything like that. But also, I think I truly believe in stepping back and taking a look at your process. Like, how is your application process going? And, like, maybe there's things you can, fix, and maybe there's things that you can scale back on and things like that. And then I was just going to say too, another really good thing that I have been doing is when we're in career fairs, is asking people what they're looking for. They might not be looking for healthcare, but asking them what they're looking for. And that's how we've gotten feedback for flexible schedules, like people looking for power hour shifts, like 4 to 9 shifts. Asking those questions, even though they're not looking for a job within healthcare, they're wanting to go into like something way different, just still getting that feedback so we can kind of know what the new generation is looking for within jobs.
Fantastic. And I would say another thing to add is to connect with one another. So these particular sessions have become kind of a community of sharing information back and forth. You can see in the comments, people are willing to help each other, even in such a tight labor market. And to have our guests here today willing to share how they're making things a positive impact, I think is just so wonderful and shows that spirit of Minnesotans, that we're all kind of in this together. So follow each other. I mean, I know Erica's always posting some cool things that she's doing, like she didn't even mention how she's working with the robotics teams and how she's incorporated virtual reality. I mean, we see that a lot with our manufacturers, but not with healthcare, right? So you want an out of the box thinker, follow Erica, because another thing that she does, like I said, is she shares that. She shares those successes, and there are things that you are doing in your organizations right now that you should be sharing too. Get that information out there and celebrate what you are doing well. So I think we are right at time now to start talking about the CNA program. Those of you who are not in the healthcare field, feel free to stay on, because we are going to get at some of the questions that have come through chat. And then during our unplugged session from 12 to 12:30, we're going to dig into your questions and really have the opportunity for you to press what is it that you really would want some tips on, and know that that Q&A period is not recorded as well. So I'm going to turn the floor over to Valerie, I just put this basic slide together, but I know that Della is popping things in the chat as well. So I'm just going to let you take it away.
Perfect. And oh my gosh, I just want to say that the last 40 minutes has just been so energizing and actually so needed, speaking personally. So thanks for just giving me that uplifting content today. So you may have heard that Governor Walz has done really kind of two things that are a little bit connected in regard to nursing assistant training in our state to meet the critical needs of our skilled nursing facilities for nursing assistants. So the first initiative, it's not on your slide, but that really was around training the National Guard, who were trained in within a week. We had the request on our, hit our door. The Sunday after Thanksgiving, training started. So we have done a great job training National Guard members who are deployed to certain skilled nursing facilities in our state. We can't have that be the solution to the nursing assistant need. So the second initiative rolled out a week or two after the National Guard initiative. And Governor Walz charged all state agency commissioners to come together and figure out a way to train and employ 1,000 nursing assistants by the end of January, so January 31st. The response from our state agencies coming together to make this idea a reality, the support from our, I'll just speak specific, especially the support we've had from our state colleges around offering trainings has been phenomenal. And it's a partnership. So we are all in this together. It was an all hands on deck, no fail mission is how it was told to all the commissioners and kind of the leaders at the beginning of this initiative. So super excited to, kind of be playing a role in this work. Right now we have 22 nursing assistant classes that are being offered in the month of January and will complete in the month of January. And those are being offered for free. And we felt that that was one way to remove one barrier, for someone who might want to be a nursing assistant. There are ways in our state, already to have that happen. Students could take the course and get reimbursed, but that initial upfront, financial barrier was one that we wanted to eliminate. We also have incorporated in the plan that the nursing assistant test will be free. Again, eliminating a financial barrier. We are also looking at ways to support students in ways that honestly are hard for us to implement, but we believe we're going to learn a lot, right? Like Annette was kind of saying, try something. Well, we're just going to try. So, if a student wants to take the class, but transportation is an issue. We are working really hard right now to figure out how to give that necessary, gas card to that student. If most of these classes are at least 40 to 50 hours of the content is online. So how do we make sure that students have the internet access that they need? So that's another way we're trying to support students. And we have an open mind about what other supports there might be that we could provide so that students can take the classes, be successful, pass the test, and get hired. We are also adding classes all the time, or we expect to be adding more classes all the time. We think this initiative will extend beyond the end of January, in part because if we have that much interest, we want to build on it. We also want to make sure we get to the 1,000, and we're pushing really hard for that end of January date. There might be some spillover into February to fully, meet that specific target. Let's see. I might put in the chat box. I'm going to put in a link, and this link will work, multiple times. So this link will get you to the Minnesota State free nursing assistant classes that are currently open. So feel free to check in on that website, use that link, daily, share it broadly. We would love to meet this goal of 1,000. We are also definitely going to be working with private nursing assistant training programs. That has been a little more challenging to, figure out and navigate in the last 4 weeks, 2 of which were holiday weeks. But we will be adding those courses, will be available as well. So there might be a different link for that. And I'll try to give you the Office of Higher Education webpage link in the chat box in a second, because they're the lead agency for this work. The other thing I will say is if you can, get your, anyone that you come in contact with, Carrie, if you can get them to the Caring Career Start Here website, there is a link in the middle of that page where interested students can give us their information. And I am in contact with these students at least once or twice a week, just providing encouragement, answering questions, letting them know we've added new classes. If you want a little bit of hope, and I think we all need hope right now, we have almost 500 people that have gone to that link and said they're interested in this. And I have to say that is just heartwarming for me. As I am emailing these interested people, and these are people all ages, all over the state. It's a very statewide effort. What I hear back from them is that they feel the importance of this call to action, and they want to make a difference. They want to be that healthcare hero that we need right now. So that has just been a wonderful part of my job over the last 3 weeks, is getting in touch with these interested students and hopefully holding their hand as they start down this path. I am also, of course, letting interested people know if we don't have a class that works for them, keep checking back. But I'm saying, contact your local care center. They have, they likely would be able to, and very welcome the opportunity to bring you on board, even without the official class at this point. So we're just trying to pull out all the stops to get people trained and employed in whatever way we can. I will pause there just because that was a whole bunch of me talking, and haven't been tracking the chat very much, but I will do that here quickly. In the meantime, if there's any questions, yeah, feel free to ask them. I'll do my best to answer.
Great.
Valerie, one of the questions that came up is, are there any CNA trainings open near Mankato?
Mm-hmm. So, yes, and we think there might be even, as I said, we think we are going to be adding more. The first private training company, it does have a class, it's already started in Mankato, but we hope to add more. So just keep checking back on that. The other thing I'll say is what we're doing with that list of interested students is we're matching that up to say, where do we have capacity to train? Where are people interested? If we have another, 20 people interested in Mankato, then it's knocking on those doors in the Mankato area. South Central College, can you add a class? Is there a private training option that can add a class? So we are, it's a puzzle. It's a big puzzle with lots of moving parts, but our goal is to find where the interest is and to make sure that there's an option for students in that area.
Great. And how do employers reach out to these new assistants or people who have gone through the training?
Thank you. I see that question, Sean. We have asked all training providers, so our campuses and the private training companies as well, to incorporate an employer connection through the curriculum. That might vary based on the specific class, and its location. But we are looking at, can you bring in employers in your area, to one of your skills days? Could you do a virtual job fair? Could you, at least give them a list of where are the employers near this community that, with contact information. So kind of anything and everything possible to connect students with a job after the training. And I will say that we've got some great creativity in this initiative as well. Both leading age and care providers are at the table as partners. So we're talking about things like, oh, can we bring a speaker to class? Can we some of the things that Erica and Annette were talking about can be incorporated into this initiative as well.
What a perfect example of engagement with your education partners and how that builds a talent pipeline. So right there, being active and being engaged can draw you this talent. So I'm going to pitch it back over to my director, Jackie. Oh, you're muted, Jackie.
Well, wow, what a fantastic hour. I'm so energized and so enthused after hearing from the speakers about all the great initiatives that are happening in healthcare all around the state of Minnesota. Really exciting. And I think what we heard this morning on a meeting that I was on before this, we heard about partnerships and collaboration and coordination and how we work together. And this entire focus on workforce is an incredible challenge in Minnesota. And I can't say that we can ever do it alone. So it's so exciting to see education and community partners and training providers and associations and employers coming together to help to resolve some of the challenges that we're facing. So in staying in that vein, we are going to have a great agenda next month on Workforce Wednesday, which is Wednesday, February 2nd at 11 a.m. And it is strategies for engaging with the Minnesota's BIPOC workforce. Another great opportunity for us to hear, how can we go about doing this? Who are our partners? Who are some of the employers who are making it happen? And we are very excited about this. So with that, I just want to thank everyone so much for coming and for participating and for hearing. And to answer another one of those questions that came through the chat, how do you contact your workforce strategy consultant? I think there were a couple links that were put in there by Della and myself, but also there is some pictures and some email addresses and phone numbers to reach them. And with that, we are going to take a minute or two to allow people who don't want to stay on for the unplugged session to actually click off. And then we would ask our speakers to stay on, and we will ask people after that 2-minute break to join us for the unplugged session. So thanks again, everyone.